Dr. Peawi says Angau and other hospitals in the country are running out of basic medical supplies and other consumables. Peawi says while the government focuses on improving the big city with infrastructures and sporting facilities, the health sector is suffering. He questioned how much of the revenue that the country makes actually goes down to the people in the rural areas.
Basic antibiotics, we don't have them. Well, what is happening? I guess the government is concentrating too much in the big city and trying to improve the infrastructure and sporting facilities and something like that to impress the outside world. But what is happening? How much of all the wealth that we generate from this country is trickling down to the majority of, say 80 to 90% of people who live in the rural areas.
Peawi says the shortage of health workers in the country is another problem. He adds while the government is having talks with the Cuban government on recruiting doctors into the rural areas, it will not solve the sector's problem overnight. The doctor made these remarks after X29, a group mostly made of nurses at the hospital, donated VP Shan's medical equipment used on patients suffering from hydrocephalus.
Basically, there was a lot of them coming in, so there's two ways to manage these patients. So one is you can give medicine, and the other one is you help by doing surgical intervention. So for the medicine we were able to give, but we weren't able to help with the surgical intervention. And that's why we decided as a group, X29, to do some fundraising and to fundraise specifically to buy the VP shunts.
Pediatrician Dr. Rosemary Kipalen says they have been treating patients without the VP shunts for about a decade now. The 10 new VP shunts cost about 6,000 kina. Mataluwis, National EMTV News, Ley.